Hi, we're here today to demonstrate how to take a blood pressure. First of all, I'm going to start off with is showing some of the equipment we're going to be using for that, and then we'll go through the procedures and how to take a patient's blood pressure. I want to start off with showing you the blood pressure cuffs. And not all blood pressure cuffs are created equal. We have large ones for large patients, and we have ones for small children, or even ones that even go down even farther that are infant sizes. This is also considered a thigh cuff. It can be used on a patient's thigh. We're not going to demonstrate that part today, but those products are also out there. We're also going to talk about the stethoscope, which is another part of what we need to do this. The stethoscope has the bell and it has the earpieces. When you use the earpieces, you want to make sure these earpieces are facing forward so you can hear. If you put them in backwards, this is going to put pressure in the back of your ear and you're not going to be able to hear very well. So I want this facing forward. And then when you use the bell, use it on the sides or hold it this way, and just put just enough pressure on the arm to obtain the sounds that you're trying to find. Just the way the bell alone is all you really need. There's a diaphragm here, and then this outside ring is what you want actually sitting on the patient's arm. And then allows for that diaphragm to move a little bit to transfer that sound you're looking for. And this is about where it's going to end up on the patient's arm. So I'll put this around my neck so I can look like a doctor to start off with. Now with this here we have a cup that's about the right size for this patient. And when I go to put it on him, there's also a range here. This range is from here to here is where this line here needs to end up when I put it around his arm. If I put this around and this ends up here, it's going to be too short. That means I need a larger cuff. If this were to end up past this line, it's going to be here, I need a smaller cuff. So put this on, wrap it around, put that on there. Also, on this gauge here, there's a couple things we're going to point out about that. All the numbers on here, you'll notice that they're all even numbers, no odd numbers. That tells me that when I document this numbers I'm going to get off here, they should be even numbers. You shouldn't have a blood pressure of 121 over 79, for example, because those numbers don't exist on here. When you're obtaining the blood pressure, you're going to pump up the cuff until you don't hear the sounds anymore. Typically, you're going to go up to about 120 to 160. Then you're going to slowly release it until you can first hear that sound. When they first hear the sound, you're going to note where that line is, or this gauge is on your gauge. And then you're going to slowly continue to release it until the sound goes away. Then you're going to note where the gauge is at that time as well. And those are your two numbers. Top number of your blood pressure is when you first hear the sound. The bottom number is when the sound goes away. So let's go ahead and demonstrate that process. Put this on the patient's arm. The valve here, you're holding your hand this way, so you can use the controls here to tighten it. It's righty, tighty, lefty, loosey. So tighten it up and pump it up. You also don't want your stethoscope to come in contact with your blood pressure cuff, because that could affect what you're hearing as well. So pump this up, slowly release it. All right, but I got this first sound that I heard was about 122, and that sound went away at about 78. So I'll record this patient's blood pressure at 122 over 78. Now there might be a situation where it's too noisy that I can't obtain the blood pressure because of that. There's another way of obtaining blood pressure. It's called by palpation. In this situation is I'm going to find the patient's pulse, and then I'm going to look at the gauge here, and I'm going to feel the pulse, and I'm going to pump it up until the pulse goes away. So let's go do that. Once the pulse goes away, I'm going to go up just a little bit more, maybe another 10 or 15, and then I'm going to slowly release it until the pulse comes back. Okay, when the pulse comes back, I can release it the rest of the way, and that's my number. I only am going to be able to get the top number doing it this way. That number, I felt at about 112. So this patient's palpated blood pressure would be 112 over P, is how we would document that. When you're actually putting this blood pressure cuff on the patient's arm, how it actually is working is we're pumping it up to where actually stopping the blood flow through that arm. So once it's pumped up, no more blood's going through that arm. And because there's no blood going through there, we can't hear anything. So when I release the valve, I'm releasing it until the heart actually has enough power to overcome the pressure that the cuff is applying. When that happens, I will get my top number. And as long as there's still some resistance to those valves, to those blood valves, you're going to have some turbulence that's going to still being heard. And it's kind of like rocks in a river. As long as the rocks are close to the surface, water's going to cross them, you'll be able to hear that noise. If the rocks are deeper in the water, you won't hear the noise because they're not affecting the flow anymore. That's what this thing here is doing. It's going to be restricting those arteries, and as the blood's trying to pass through there, as long as there's some resistance, it's going to make some noise because of the turbulence. As that opens up more and more, and the blood flows through there better, no more noise is going to be heard because no more resistance being applied. That's the simple concepts and how we take a blood pressure. Thank you for watching, and next time we may be able to demonstrate how to use that guide cuff that we talked about. Bye.
It was an eye?
Yes. All right.